Coronavirus, right? Kung flu.
Said to my people, slow the testing down, please.
None of us have ever been told to slow down on testing. In fact, we will be doing more tests.
Trump has this sort of track record of disregarding and undermining science. His administration has sidelined scientific data, scientific advice, its approach to environmental and health policies. Since coronavirus hit, it's sort of been a continuation of that attitude where the president hasn't really respected or abided by what various scientific advisors have said at various points.
A month ago, nobody ever heard of this. Nobody had any idea.
Nobody could have known a thing like this could happen.
All of a sudden, out of nowhere, came the invisible enemy.
That's absolutely not true. Trump had ample warning to act more quickly from the WHO and from officials within the administration itself. And epidemiologists have been urging governments to prepare for a long time.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. We have the best tests of any country in the world. I think I read where if you add up every other country in the world, we've tested more.
Trump has touted the U.S.'s testing capacity. He's often said the U.S. has the best testing in the world, which just isn't true. But at the same time, he's also said, testing isn't really necessary, or we don't really need to do that many tests.
If we didn't do any testing, we would have very few cases. When you do testing to that extent, you're going to find more people. You're going to find more cases.
But that's sort of the point. If you keep testing, you know who is infected. You're able to treat them. You're able to keep them from infecting other people.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. The disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? It sounds interesting to me.
It was sort of outrageous and very dangerous to suggest that people should inject disinfectants like bleach into their veins. But what was also interesting was in that moment, Trump turned to one of his top public health advisors, Dr. Deborah Birx, and sort of tried to negotiate, why not try it out? Why not? Can we study that? It shows a lack of understanding for how the scientific process works. Donald Trump has been repeatedly touting hydroxychloroquine as a cure for the coronavirus.
He bought massive amounts of it. And some people say, let's go to a laboratory, let's test it for a couple of years. And no.
Early research have found that it's maybe not the most promising treatment.
Are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect?
The president has sort of dug into this to the point where he said he even took the medication as a preventative measure.
I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
It really goes against the scientific consensus.
Also weigh in on this issue of hydroxychloroquine. What do you think about this, and what is the medical evidence?
That question?
Yeah.
Well, I
Maybe
love to hear
15,
from the doctor.
15 times. You don't have to ask.
He's your medical expert, correct?
I think what's interesting in that clip there is that, it shows that Trump is comfortable interjecting or interrupting when public health experts are talking about.
Can you take it off because I cannot hear you?
I'll just speak louder, sir.
Oh, okay, good. You want to be politically correct. I just don't want to wear one myself. It's a recommendation. They recommend it.
Wore one in this back area, but I didn't want to give the press the pleasure of seeing it.
The fact that the president doesn't wear one, I think, sort of muddles the public health message. Researchers can debate, exactly how effective these masks are. That said, it is currently the CDC's advice to wear masks when you're out and about, and many states have mandated or required people to do that when they're in crowded places.
The country wants to get back to work. Here they're going to keep Los Angeles closed till the end of August. That's a death wish. We did the right thing. Now we open. We got to get it open.
I'll say it yet again, that you should not congregate in crowds.
Public health officials, epidemiologists say you can't just rush to reopen. You have to be cautious. Even the White House plan says that, but Trump has repeatedly encouraged or pressured states to reopen more quickly. One of the most important things in responding to a pandemic is to have this unified and clear message to the public. That requires that the administration and scientists are on the same page. And sometimes it feels like they're not.